Currently, there are two types of tests for SARS-CoV-2, which provide different kinds of information. Diagnostic tests tell us if someone is currently infected. Antibody tests, also known as serology tests, tell us if an individual was infected in the past and has had an immune response. Serology testing does not detect the presence of the virus, but rather detects the antibodies that are or were produced by the body in fighting the disease. Antibodies are proteins produced by the immune system in response to an infection and are specific to that particular infection. They are found in the liquid part of the blood called serum or plasma. Immunoglobulin M or IgM is the first type of antibody produced in response to an infection and is detectable 4 to 7 days after an infection starts. IgM antibodies are short-lived, and their existence signals a new infection is present. Immunoglobulin G or IgG antibodies are produced 7 to 14 days after infection. These antibodies can be detectable for weeks, months, and even years depending on the antigen and the individual. IgG antibodies are usually sustained for a longer time and may play a role in lasting immunity. However, since we don't know a lot about SARS-CoV-2, as it's a new virus, we don't know how immunity against this virus works. Total assays, which are combined IgG-IgM tests, cannot distinguish between early IgM and late IgG antibody responses. As a result, total assays can't reveal whether a person has the IgG antibodies that are needed for longer-term immunity, or if they are currently infected. For clinicians, knowing whether an individual has developed SARS-CoV-2 specific IgG antibodies could be critical to determining immunity. An IgG-specific serology test reveals if someone had COVID-19 in the past and as a result has developed antibodies that are specific to this virus. The right type of serology test could help us understand immunity against COVID-19 at an individual and population level. This can be a key tool to help us develop plans to reopen society.
When someone gets infected with a virus, like SARS-CoV-2, you mount an immune response. And what happens there is COVID-19 is circulating, you build antibodies, those antibodies attack the virus and clear the virus from your system. This is the basics of immunology. If someone contracts COVID-19 but shows no symptoms, serology could be used within 3 to 10 days to determine whether they have been infected. Your body first has a rise in immunoglobulin M, or IgM. Following that, usually around 7 to 14 days later, depending on the virus, you mount immunoglobulin G. The IgG response is the later response and the one that is long-lasting. In a healthy individual, IgM levels will rise before IgG levels. You can see IgM levels right as someone's been infected. So someone who has active COVID-19, towards the middle to end of that, you'll start seeing IgM rise. IgM clears the body quicker than IgG. So we look at IgM to tell us that someone's recently been infected, and sometimes using IgM, you might be able to say that someone might still be infected. Then you have IgG. IgG starts spiking, especially as IgM starts coming down. IgG is what we look at to see if someone has long-lasting immunity or mounted a long-lasting immune response. So even if the person was asymptomatic and had COVID-19, if a random sampling of the population were done, that person might show that they have antibodies to COVID-19. That means they were infected with COVID-19 and they've mounted the appropriate immune response to combat the virus in their system. When we talk about immunity to a virus or a disease, we talk more about immunoglobulin G because that's the immunoglobulin that lasts longer. It tells us that someone's been infected and that they've recovered from it.